Hello everyone. My name is Dr. Afifa Zareen and I'm one of the pediatricians at Care Hospital, Banjara Hills. So today we have a very interesting topic to talk about, and many parents are very unaware of this topic, but it's a very common topic and it's very important for the growth and development of your child. So today I will be talking about vitamin D and the deficiency of vitamin D in children. So as a layman and as a common person, we have been hearing about vitamin D so many times. Like we get vitamin D from sunlight, from cod liver oil and fish liver oil. This is like everybody knows that. So I'll be talking in more detail. So vitamin D is one of the fat soluble vitamins apart from vitamin A, D, E and K. And why is it important? So vitamin D is usually deficient in children, especially children who are exclusively breastfed during the first year of life. We recommend that vitamin D has to be given to each child every day till 1 year of age. Apart from that, vitamin D is very essential for growth and development of the child. Then apart from that, what is the recommended dietary allowance of vitamin D? So recommended dietary allowance is the minimum amount of vitamin D which your child should take every day on a daily basis. So it's approximately 400 international units to 800 international units. So suppose if your child is not taking inadequate amount of vitamin D, so what happens? So on a long-term basis, there is a disease called as rickets which occur in children, which is in counterpart with osteomalacia in adults, which is caused by vitamin D deficiency. So what happens in children who suffer from vitamin D deficiency, which is called as rickets as well? So these children are very irritable. They have some amount of developmental delay. They have difficulty in walking. They have difficulty in running and standing up. Some children have difficulty in breathing due to decrease in level of calcium, which is secondary to vitamin D deficiency. Apart from that, you can see other symptoms, like you can see the skull of the child is very prominent. The wrists have become more wider. Apart from that, the legs of the child when the child is walking are curved and the child is unable to walk properly, and he has a lot of bone pains as well. Apart from that, he has abdominal pain and he has prominence of ribs. When you see the ribs, you can see that the ribs are very prominent. So these are some of the signs and symptoms of vitamin D deficiency. So vitamin D deficiency is very extremely common in pediatric age group because children have growth spurts. So during these growth spurts, you need to supplement extra vitamin D because vitamin D is very essential for calcium absorption from the intestine and mineralization of bones with calcium and phosphorus so that bones are strong and healthy. If the child has deficiency, then he's going to have like fragile bones and he's going to have repeated fractures with simple trauma and simple falling on the ground. So it's very essential that as a parent, you know about the signs and symptoms of vitamin D deficiency. And if you see that your child is having any of these, then you need to see a local pediatrician as soon as possible because this is an absolutely reversible condition and absolutely can be treated. And not treating it can hamper your child's growth and development. So that's all for today. I hope you enjoyed my talk. Thank you.